This is big picture anatomy with a look at the overall structure of a long bone and also what the bony tissue looks like in the microscope. So if we take, let's say, a longitudinal slice down the length of a long bone, what we're going to find is that we have three regions. We have the diaphysis or shaft of the bone along the middle. And then the epiphysis at either end of the bone. Epiphysis is singular, epiphyses with an E would be plural. A proximal and a distal epiphysis. If we take a cross section across the middle of the diaphysis, what we're going to see is this open marrow cavity in the middle and a tube of bone around the outside, just like this, formed out of dense or compact bone. In life, that marrow or medullary cavity in the middle would be filled with the rich blood-forming marrow tissue. As we get out towards the epiphysis, we're going to see that the space starts to be filled in with these little trabeculae, or tiny little plates of bone. And the entire epiphysis would be filled in with trabeculae, and interspersed among the trabeculae is also going to be marrow tissue. The outer cap of the bone is formed out of articular cartilage. It's hyaline cartilage that forms a nice, smooth, and somewhat resilient plastic-like surface for articulation with the next bone in the series. And of course, between the epiphysis and the diaphysis, we're also going to find a thin layer of articular cartilage called the epiphyseal growth plate. This is going to be thicker in a baby or a child, and what it does is allows for the diaphysis to grow out into that growth plate so that you don't have to constantly rebuild an entire new epiphysis as the bone grows in length. In another video, we'll talk about bone formation and growth in general. The open space in the diaphysis with a tube of bone around the outside, as well as the orientation of all of the trabecular plates, creates a very lightweight calcium or stone rock-like structure to the bone, but one that provides actually more mechanical resistance, depending on whether it's a bone that's in compression or in tension, than you would get if it were made all out of solid calcium or rock-like material. Moving on, when we look at the microscopic structure of the bone, in other words, we take a little section, whether it's of a trabecular plate or a piece of dense bone, and magnify that into the microscope, we see yet another way in which this microstructure of the bone gives it tremendous strength. And what we find is that at the microscopic level, bone is very much a living tissue, and it has to form around the blood vessels that infiltrate into the cartilage to form the bone, and it forms these very particular types of microscopic structures called osteons or haversian systems. And when we look at detail at an osteon or haversian system, what we see is that at the center is what's called the central canal, where the blood vessel would be located in life, and bony tissue actually forms in layers around that central canal. Those layers are called lamellae, or layers of bony tissue. In the lamellae, we find living cells called osteocytes in little spaces in the bone that are called lacunae. Lacuna would be one, lacunae would be plural. Spanish speakers, that's the same root as the word laguna, meaning a little lake or open space. And those osteocytes are spaced along the lamellae, and they actually have tiny little cellular pseudopods or projections that reach out into the bony material and touch each other through what are called canaliculi in the bone, so that they're all sitting embedded in solid bone, very low level metabolism in these cells, but touching each other and sensing the structural or mechanical integrity of the bone. If the osteocytes detect that there is a microfracture or problem in the calcium carbonate rocky structure of the bone, they will emit a hormone that will bring in osteoclasts, which are cells that degrade the bone and bore holes into it using hydrochloric acid. And then that would be followed by osteoblasts that would lay down new layers of bone. That process of bone remodeling is another topic for a future video. So, just to recap, what we have is the entire structure of a long bone formed by the shaft or diaphysis, which has a collar of dense bone around the outside and that hollow marrow cavity along the middle filled with blood-forming bone marrow in life. And then at the ends, the epiphyses with their trabecular plates forming strong structural integrity for the bone at either end. On the caps, we have articular cartilage forming a smooth plastic-like soft surface for articulation with the next bone in the series. And of course, that epiphyseal growth plate also made out of hyaline cartilage to allow the diaphysis to grow in length. If we look microscopically, we see that we have these osteons or haversian systems formed with a central canal where the blood vessel is located and layers of bone around the outside with those very funny little osteocyte waiter cells sitting in there waiting to sense microfractures and call in the bone remodeling cells. That then is a look at the structure of a long bone, both at the macroscopic level and at the tissue level in the microscope from big picture anatomy.